In the article Careful Devices, researchers are working on a humane way to monitor and track individual patients for their health. Now, this project, when completed, would be revolutionary to the healthcare world because patients could go in to see their physician, and their physician would be able to look at their overall health of the individual patient instead of a generalized view. Now, this could range from monitoring their blood pressure to beats per minute to even, as the article discussed, the patient's ovulation cycle. Now, with the product ovum being designed, couples looking to conceive would be able to know when would be the best time to attempt with the device monitoring. Now, this product could be modified to help with monitoring blood pressure, blood sugar levels, beats per minute, ovulation cycle, and so many more aspects over time. Now, this would increase efficiency and treatment of the individual patient. However, we must also overcome the obstacles with devices like these, such as gaining consent and spreading awareness of the product.
The Careful Devices article addresses some of the faults of in-home self-tracking devices. These technologies that are meant to give the average person a better understanding and a better control of their health should, as the article states, produce reflective data. This means that these devices should provide information that is interpretable by the user. Devices should not analyze the data for patients. That job belongs to the doctors. These devices should not replace the doctor, but act as a means to gain supplemental data. When self-tracking devices begin to analyze the data that they gather, users will often incorrectly self-diagnose or develop anxiety over their health. The article also creates a design manifesto for what these in-home medical devices should accomplish. A device that I believe satisfies these conditions is a sleep tracking device called Bedit from Apple. My brother uses one, and from what I've seen, it's an example of a careful device. It sits comfortably underneath your bedsheet in the context of your home, but more importantly, it produces interpretable data such as the hours you slept, hours you snored, and even heart rate throughout the night.
All of Us is a research program that seeks to improve health by identifying risk factors and biomarkers like environmental exposures and social determinants using data from millions of people in diverse communities. I think this is a great opportunity for the 80% of people who were previously underrepresented in research so they can have a chance to participate and contribute their health data. Like the article states, I think it's important for all of us to have a diverse population in order for its data to accurately reflect the population in the United States. A possible downfall to this program is if the participants share false information or are not consistent with sharing their data in the long term. Privacy can also be an issue as participants are uploading their personal information into a large system. And another issue is trying to collect all that patient data from the different electronic health record systems. But if this research program is successful in combating these potential issues, I think that it can help medical breakthroughs occur more frequently with the data that it can gain.
The video given to us this week is an infomercial on what the All of Us project aims for. It gives a brief explanation on precision medicine in simpler terms, by introducing normal, everyday people who receive the same healthcare. Precision medicine aims to counter this by analyzing data from 1 million volunteers who signs up for the All of Us research project, to ensure that medicine is catered to the individual. The video describes that medicine that is made specifically for the individual will help people and their descendants live longer, healthier lives due to the millions of patient data analyzed from volunteers of the project. I think that it was very similar to what the lecture discussed on Wednesday's lecture. For healthcare to correctly utilize social media, for example, as discussed in the lecture, I believe it needs to target users in the individual level. Healthcare Twitter, for example, usually rolls out tweets that only apply to the general public, and it doesn't feel like it was targeted towards the user, but more of a marketing tweet. Precision medicine will be a great application for this to improve user interaction with healthcare in many different settings, and the All of Us project is a very ambitious way of improving that aspect as well.
In lecture, we discussed the ethical, privacy, and confidentiality issues with the healthcare records. I believe that these issues are always going to be around because there is no definite answer to what extent certain information should be shared and with who it should be shared with. Also, in order to decrease ethnic concerns in healthcare settings, patients should be reminded on the information they sign. And even better, clinics should practice good design of the contract from the beginning so people can easily understand and are encouraged to read thoroughly before signing anything. An important discussion we had in class was regarding whether parents should have full access to their children's medical records. I personally disagree with this and think that all individuals should be given the option to make their own choice to share it with whomever they want, regardless of their age. Not every children have guardians they can truly rely on, and some even may be in an abusive environment. And considering these records are very personal, the information should not be shared without the patient's agreement.